Hey everybody, it's Caitlin. Today is Monday, April 6th, and welcome back to CoronaChat. So although the news has been focusing a lot on what's going on in hospitals, many people who become infected with coronavirus will be able to recover with care at home. And with the number of people who are getting sick, it's very likely that at some point, many of us will find that we're having to take care of a loved one at home. And so today's video is going to focus on what we need to know to care for somebody at home and how to decide if and when it's time to go to the hospital. Let's dive in. By now, you probably know that the main symptoms of COVID-19 are a dry cough and a high fever. And some other symptoms to keep track of are suddenly losing your sense of smell or taste, vomiting or diarrhea, suddenly being really tired, and tightness in your chest. And some people have described this as feeling like they're an elephant sitting on their chest. If someone you live with develops any of these symptoms, even if they haven't yet tested positive for coronavirus, it's probably best to act as though they do have it. So what should you do? If possible, you want to give this person their own bedroom and bathroom. And if it's possible to limit them to the room they've already been sleeping in, that's the best option. And they really shouldn't leave this room for any reason other than to go to the bathroom. This will limit how much they spread virus particles around the house. If there's not the possibility to put this person in a separate room and have them use a separate bathroom, that's okay. What you need to do is just try to make sure there's as much space between that person and everybody else in the household as possible. So maybe, they can sleep in one side of the apartment and the rest of you can sleep in the other side of the apartment. I'm thinking in particular about, kind of small studio apartments. Or if there's one bedroom, maybe that person can stay in the bedroom and other folks might be able to kind of camp out in the living room or something like that until the person who's sick has recovered. If you've got to share a bathroom, that's fine. You just want to make sure that the person who's sick is keeping on a face mask, kind of if they're just going to the toilet, that everybody else in the household is using a face mask, and you want to make sure that you're cleaning down solutions and disinfecting them, either with kind of a disinfecting wipe or a solution made out of 10% bleach. So that's 1 part of bleach, 9 parts of water, so that you're cleaning down all those surfaces as much as possible. If it's possible, the person who's sick should wear a face mask. Homemade face masks are great for this because this will limit how much they spread virus particles around the room when they're coughing. They need to put on a fresh mask every day, so having a bunch of homemade masks on hand here can be really helpful. And when they put that mask on, they wear it for the day and they take it off, it can go straight into the laundry and be washed, and then the sick person can use that again. Totally fine. Let's talk a little bit about managing symptoms. The person who's sick can take Tylenol or acetaminophen to help keep their fever down, and take over-the-counter expectorants and decongestants, things like Dayquil, Robitussin, anything like that, if it helps to ease their congestion and make them feel more comfortable. You may have seen some things on the news saying, don't take Advil, people who take Advil and have coronavirus have bad outcomes. As far as we can tell, this isn't true. It doesn't seem like Advil or any other NSAID is causing any kind of increased illness, more severe illness, longer illness, more death. We don't have any evidence to support that. So if what you've got at home is Advil, from what we know right now, totally fine to take that. But if you've got Tylenol at home and it makes you feel safer to just take that, that's okay too. What we're really trying to do here is just manage that fever so that the person who's sick isn't totally miserable and burning up. Right now, it's not clear if herbal remedies that try to boost the immune system, things like elderberry or echinacea, are a good idea. And the reason this is because some people who are young and healthy seem to be having a very, very strong immune response to coronavirus and may be developing something that's called a cytokine storm. A cytokine storm is when your immune response is so strong that your own immune system overwhelms your body and makes you sick. We're not sure yet if the young people who are getting really sick with coronavirus are definitely having cytokine storms. It's still a hypothesis right now. But as long as that hypothesis is kind of out there moving, it seems like it's probably a good idea to not try to do anything to put the immune system into hyperdrive, right? We just want to manage symptoms. So again, taking things that are going to help reduce fever, taking things that are going to help kind of loosen up some space in your chest by dealing with decongestants and things like that seem to be the best way to go. The other thing to keep in mind is that the person who's sick needs to stay hydrated, and they need fuel to keep their body strong. So even though they probably won't have much of an appetite, they need to try to eat and drink something. So your normal flu comfort foods are great options here. Chicken noodle soup, tea and toast, all that kind of stuff that, maybe your mom or your grandma made for you when you were homesick with the flu when you were a kid. All of those are good options. So how do you decide when you should go to the hospital? Typically, we're looking for signs that the illness is becoming more severe. So if the person's really saying, my chest is so tight, I'm really having a hard time breathing. If for any reason their color starts to change, right, they start looking a little blue, they're gasping, any of that kind of stuff that would make it seem like they're having difficulty breathing, that's a sign to start thinking about going to the hospital. Other things you want to look for are very high fever, particularly over 102 degrees Fahrenheit, over 38, 39 degrees centigrade. Particularly if that fever is really lasting and can't seem to be controlled by, your normal fever reducers like an acetaminophen. The other time you might want to think about going to the hospital, even if somebody doesn't seem that sick, is if they've got underlying conditions, right? Things like asthma, things like an underlying heart condition, certainly if someone has COPD or other kinds of respiratory concerns. Before you go to the hospital, you want to call your doctor or call urgent care and get a second opinion. This is because hospitals right now are starting to be very, very overwhelmed. And if your loved one has something else, like seasonal allergies, that could be controlled with something like Benadryl, and they don't have coronavirus, the last thing you want to do is send them to the hospital with all the coronavirus patients so they come home with coronavirus, right? So the first thing you want to do is, again, if you've got a doctor who's your regular doctor, pick up the phone, call that person. If you don't, or if it's a night or weekend or you can't get in touch with them, you can pick up the phone and call your local urgent care office. Or your local urgent care clinic. And if you're getting any signs from any of those folks that, it's time to go to the hospital, or again, any kind of emergency situation, somebody who can't breathe or really seems very, very ill, you want to get them over to the hospital into your coronavirus ward. So, hope this has been helpful. And tomorrow we're going to talk about what you do to protect yourself as you are a caretaker for somebody with COVID-19. Stay safe out there, and I'll see you all back tomorrow.